We have dissected the posterior mediastinum. So let us identify posterior mediastinal structures that we can identify here, starting with the bigger organs or the bigger structures. You have two large tubular structures here. Right here on the right side, no? This one is the esophagus or the food tube, and this one is the descending thoracic aorta. So let us review other mediastinal structures. We have here the left mainstem bronchial tube, and then the left pulmonary artery. So okay, let me show you structures that are found right in between the aorta and the esophagus. So you can see right there at the tip of the forceps, there's a vascular structure with thin wall that is actually the thoracic duct. The thoracic duct is a lymphatic vessel. That's the more inferior segment of the thoracic duct right there, the tip of my forceps, and the dark colored vessel that you can see right there, that's the azygos vein, large vein of the posterior chest wall. Okay. The aorta, no? This one, the thoracic aorta, is the largest artery of the body. So let us identify some of its branches here, no? So that branch that you can see, that is hooked by the forceps, try to trace. It goes to, you can see it's going to the esophagus, no? So that is esophageal branch of the thoracic aorta. So it's part of the blood supply to the esophagus. So the upper segment of the esophagus, actually it is supplied by blood coming from the inferior thyroid artery. The middle segments here primarily receive blood from the esophageal arteries coming from the thoracic aorta. We can see another one right here, actually. That's another esophageal artery or branch to the esophagus right there. The distal esophagus partly receive its blood supply coming from the left gastric artery, which is a branch of the celiac tract. So let me show you once again the thoracic duct right there. It's at the tip of the forceps. The duct comes from the abdomen also. It is a lymphatic duct arising from the cisterna chyli. So it enters the mediastinum at the opening where the aorta exits from the thorax going to the abdomen. Okay. The thoracic duct carries lymph from most parts of the body, and it also carries lymph coming from the intestines. So lymph is tissue fluid. It is fluid coming from the tissue spaces. So lymph coming from the intestines has a high fat or lipid content. So when there is a rupture or injury to the thoracic duct, then this fatty lymph, no, or chylous lymph, no? Chyle is the lipid in serum, no? Or in tissue fluids, no? So this chylous lymph, no, will fill up the mediastinal compartment, no, the pericardial space, and that condition is called chylothorax. So for the other branches of our